My pleasure to welcome Janel Soucie with us for our today's Lunch and Learn. Janelle is a PharmD and an Instructional Associate Professor, also has many roles, Office of Experiential Programs Regional Coordinator, and the Office of Experiential Programs Disability Resource Center Liaison at the University of Florida College of Pharmacy. In these roles, Janelle provides leadership for the implementation of accessible rotation experiences, as well as oversight of the University of Florida's experiential rotations in Central Florida. Janelle has nearly 19 years of experience in experiential education between her current roles and prior experience as a clinical preceptor for APPE students and pharmacy residents. Janelle earned her Doctor of Pharmacy degree in 2002 and completed a primary care pharmacy practice residency in 2003. Since that time, she has practiced in a variety of settings, including ambulatory care, which is her current area of clinical expertise. Janelle is passionate about experiential education and has published and presented nationally on various experiential education topics. So Janelle, thank you so much for coming on board Zoom and presenting for us today. Again, this is recorded and will go out after for those who could not be here.
And thanks so much for inviting me.
Yeah.
I will work here on sharing my slides. So one moment. I will definitely make sure I'm sharing them. Am I sharing them correctly? Can you see the slides on the, okay.
Yes.
All right. Well, I just wanted to say thanks so much for having me today. I'm going to see if I can move there we go. So I can still see some folks, but have it not right in front of the slide. All right. Well, thank you again so much for having me today. Thanks to Melissa and her team for inviting me. And so the topic that I was asked to present today is to discuss supporting access in pharmacy experiential education. And with that, navigating disability accommodations kind of in the experiential realm. So what I would like to start with is talking for just about a few reasons why would we talk about this topic today. Well, a lot of us are familiar with the Americans with Disabilities Act, perhaps somewhat familiar with the Section 504 of the Rehabilitation Act of 1973. But basically, the bottom line is that both of these acts have requirements that apply to education in terms of ensuring that students have full opportunity to enjoy the benefits of post-secondary education. And these requirements apply to nearly every school in the United States, including post-secondary schools, such as pharmacy school. So that's a reason that we need to be familiar with this topic as we all are participating in pharmacy education. In addition to those requirements, we also have the Accreditation Council for Pharmacy Education that does require colleges and schools of pharmacy to provide reasonable accommodations to students with documented disabilities that are determined by the University Disability Office or the equivalent of that office. Additionally, our accreditation standards require that we support faculty in providing accommodations to our students with disabilities. And faculty support, of course, includes support of our experiential preceptors. So that is one of the reasons why I was invited to participate in your Lunch and Learn today. In addition to those things that I already mentioned, we're also seeing a trend in terms of an increasing number of students with disabilities participating in higher education. So while you may not, as a preceptor, may not yet have had the opportunity to partner with your school or college of pharmacy in providing disability-related accommodations in the experiential setting, it is an opportunity that you may encounter in the future. So with that, let's talk about how the ADA or what the ADA definition for disability is. So the ADA definition is that a person with a disability is someone who has a physical or mental impairment that substantially limits one or more major life activities, has a record or history of such an impairment, or is perceived by others as having such an impairment. Now, it's important to note that some disabilities are, actually, let me just double check. I'm not seeing on my end, are the slides advancing correctly? Are you seeing
They are perfect.
Okay, thank you. So some disabilities are visible, others are not visible. So the ADA does provide several examples, and I'll read through a few of those. That includes diabetes, autism, low vision, hearing loss, depression, and mobility impairment. But those are just examples. If you go to the ADA website, you see lots of other examples, but they definitely note that examples are just examples, and there are others as well that would be included. So now let's talk about what accommodations are in the context of health science education. So accommodations are reasonable and effective academic adjustments or auxiliary aids that allow students with a disability to have access to education, which is equivalent to their peers. And you can see the source of that is coming from there listed on the bottom of the slide. Now, accommodations do modify the usual approach to accomplishing outcomes. However, they do not change the standards of the program. They don't create an unfair advantage for a student, and they don't cause an undue burden on the college or the practice site. Some examples of accommodations include extended time for testing, assistive technologies like screen readers, note takers, and then alternative format assignments. But what I'm going to do is a couple slides ahead, I'm going to talk about some examples of accommodations in the experiential setting. So now that we've talked about what accommodations are, what I thought might be helpful is to talk about the process for determining whether a student will receive accommodations, and then also how those are implemented. So the first step is generally for the student to register with the program's disability service office, thus letting the school know that they have a disability and that they're seeking accommodations. Now, it should be noted that some schools of pharmacy might not have a specific disability services office, in which case student accommodations would be addressed by an assigned department, such as perhaps student services or student affairs. Now, once the student has been in touch with the disability service office or equivalent, the disability resource professional, which I tend to abbreviate as DRP, will work with the student to collect information regarding the student's disability status, and that would include any documentation that's required by the program. And then also they would work with the student to collect information about any barriers that are associated with the disability. And then through an interactive process that occurs between the student and the disability office, a determination is made whether accommodations are needed, and if they are needed, what accommodations would be appropriate. Now, this interactive process might include faculty and other experts from the school, like from the program, who would then be able to provide insight into the activities and requirements of the specific program that kind of factor into those conversations, that interactive process between the student and the disability service office. Now, once the accommodations are approved, then generally what we're going to see is some documentation is prepared to note what those accommodations are. Now, the documentation might look different from one program to the next. In some cases, such as with our program at UF College of Pharmacy, this is going to be a formal letter that's provided to instructors and also to appropriate program personnel. But again, that documentation might look a little bit different from one program to the next. In addition to that, the subsequent procedure for how instructors are notified and how accommodations are implemented can vary between institutions as well. And so what we're going to do today is to have some time at the end of this presentation for your program personnel to describe kind of what the Western New England University procedure for notification and implementation of experiential accommodations looks like, so that you will be familiar with that. All right, so as promised, on this slide, I have listed a few examples of accommodations in the experiential setting. I do want to note that accommodations that students have approved for the experiential or clinical setting are not necessarily the same as what they would have approved for the classroom setting, because as you can imagine, those settings are very different. So the barriers that students might encounter in the experiential setting might be different than what they would have encountered in the classroom setting. So it's going to be important that accommodations are appropriate for the experiential setting. Now, some accommodations that I've seen the most commonly in my college include a geographic site selection. So for example, for students who need to be near their healthcare providers for appointments during rotations, we might schedule those rotations within a certain geographic area. Other examples include periodic breaks to manage medical conditions, various types of assistive technologies, and then also having access to a chair or stool at the rotation site. So those are ones that I've commonly seen. However, we've certainly incorporated other accommodations as well. And then on the next slide, what I'm going to do is take a few of these example accommodations that I have listed here and talk more about examples for how those could be implemented at the rotation site. So a couple examples here. And what I want to start by noting is that, of course, how accommodations are implemented it's going to be individualized to the rotation. But with that, what I hoped would be helpful would be to provide a few examples of some potential approaches to implementation. So for the first example, what we have is an accommodation for a low distraction or quiet area for the student to use when charting or working at patients. So when we're looking at that example, one thing to consider is whether and in what way this accommodation applies to the rotation type. So for example, on some rotations, charting and working at patients is going to be routine, and that's going to be just part of daily workflow. But for other rotations, that might not be kind of a routine part of the daily workflow. So for example, perhaps on a non-patient care elective where the activities are going to be a lot more operational and administrative in nature, perhaps that's not going to be kind of a routine activity for the student. And so these would be important conversations to have with your experiential coordinator to better understand how the accommodation applies to the preceptor specific setting. But let's talk about, so for rotations where working at patients and writing notes might be kind of routine, that's something that is done regularly. Some ways that this low distraction area might be incorporated would be perhaps in an area of the pharmacy that's kind of away from the main hustle and bustle of the workflow. Or perhaps the preceptor might identify an appropriate or an area that's kind of not in the pharmacy itself, but where the student is able to work and still have appropriate access to their preceptor. Or the preceptor might choose, I should say, the preceptor might choose to discuss other available options with their experiential coordinator and kind of by extension, the disability resource professional, such as whether the use of noise canceling headphones in appropriate work areas might be a good approach to consider. And that could be part of that interactive conversation that we talked about. So let's talk about another example. So we have assistive technology, in this case, speech to text software. So a good place to start when approaching this accommodation might be to consider what assistive technology or AT options are already available at your site. So many experiential sites already have assistive technology embedded within their systems, and there might just not be a full awareness of kind of what those capabilities are until we start to look into it and research what the options are. So for example, common operating systems like Windows and Mac already have built-in options for both text-to-speech and speech-to-text technology that wouldn't require a separate purchase, wouldn't require us to download a different software that would then need to be vetted by the site, and go through all kind of the privacy steps and all those things that need to happen. And so kind of using this approach provides us another benefit in that if we utilize technology that's already available at the site, this can really help to circumvent challenges with some of the privacy issues that we can encounter, compatibility issues in terms of technology being compatible with each other. And so it can help us just to navigate some of those processes pretty smoothly. Of course, I'll have to note that that's not always possible, in which case the school and the site can definitely have conversations about what kind of technology would be the most appropriate to use in that context. And then for the last example of health-related absences to attend medical appointments, I'm going to review some more information on the next slide. So here, I thought to discuss the example accommodation of health-related absences to attend medical appointments, what I thought I'd do is show you the way that we've approached this accommodation at the UF College of Pharmacy. So for this accommodation, what we've done is developed and we utilize a specific form that the student completes together with the preceptor. So this form was developed in collaboration with our Disability Resource Center and kind of in response to a few situations where there was some confusion about how to approach the accommodation, as well as whether hours missed kind of in this context needed to be made up. So with the form, and I know it's not super easy to see on the slide, but what I'm going to do is kind of talk about some of the aspects of the form. It's completed by the student and the preceptor during the first week of the rotation. And so some things about the form to note is that both the student and the preceptor responsibilities regarding this accommodation are identified on the form. So it's kind of right there for both to know. The policy regarding overall completion of hours is also on the form. And then resource personnel for a student or the preceptor to reach out to if there are questions or needs or concerns that arise, those are also identified there. And so this helps us to ensure that kind of everyone's aware of what is needed and who to reach out to if there are questions, which does help to minimize areas of confusion related to the accommodation. Also, some things to note are that the plan is developed proactively. So it's developed during that first week. So it's done early, basically, and the student and the preceptor do it in collaboration with each other and then document that in writing. So if absences do occur, everybody knows in advance how they're going to be addressed and because they developed this plan together. And then, of course, what I've described here is the way that we have chosen to approach this accommodation at the UF College of Pharmacy, but certainly there are other ways that this could be approached as well. And this is just an example of one way that it could be done. So now that we've talked about some examples of accommodations, we talked about what accommodations are, let's move on and talk about challenges that preceptors might experience as they encounter opportunities to navigate experiential accommodations. So a lot of these challenges might kind of stem from some uncertainty regarding the specific accommodation, as well as what is the process for implementing that accommodation. So for example, there might be some uncertainty regarding if the preceptor receives a letter, who should they reach out to at their affiliated school regarding the accommodation request? What is the appropriate notification process that the school has in place? So was the way that I received the letter appropriate? Does the school know about this letter? I mean, my experiential coordinators know about the letter? So those might be some questions that come up. When you review the accommodation, there might be questions about what the accommodation means. Like what am I actually being asked to do with this accommodation? There might be some questions about, well, how do I actually implement this in my specific rotation? There might be some other concerns that come to mind as well regarding, might there be impact to my time? There could be some questions regarding resources or equipment that might be needed. Who's responsible for costs, if there are any costs associated, and then other questions as well could come up. So with that, we've talked about some challenges that preceptors might encounter, but let's also talk about how you could address some of these concerns and how preceptors can navigate this process effectively. So perhaps first and foremost, please know that it is okay and it's very welcomed to ask questions. And if you have questions, then please do reach out to your College of Pharmacy experiential coordinators, because they and their associated disability resource professionals can help you navigate the questions. So with that in mind, a first step would be to identify, like, who do I reach out to? Who are your affiliated school, College of Pharmacy experiential personnel? And of course, some of those personnel are on this meeting today. So just making sure you have their names and contact information handy can be very helpful. Another step could be to familiarize yourself with your affiliated school's procedure for experiential accommodations, or at least kind of know where to find the information, or that could come back to knowing who to reach out to, so that if you do have questions, you have that information accessible to you, and it helps you to be a little bit more comfortable with navigating that process. I kind of already talked about this a little bit, but definitely be very comfortable having dialogue with your experiential personnel, as well as with the student regarding the accommodation, noting that your school personnel, the student, the program's disability support personnel are all there to support you and work with you in the process to make sure everybody is navigating it well and successfully. Another strategy that can be very helpful is to give students the opportunity to visit the site in advance of their rotation, if that's requested of you. And this allows the opportunity for the student to see your site, kind of have a conversation with you, with either preceptor about expected rotation activities, and with that, to better identify any access needs that they might have kind of ahead of the rotation, as well as identifying approaches that could be used to meet those access needs. And this can help a lot with guiding advanced planning on the part of everyone involved, basically the student, your experiential coordinators, and the preceptor. I've actually heard very good feedback from both preceptors and students about how helpful this approach can be. So if you are asked to provide the opportunity, then definitely consider working with your site to allow that flexibility if possible, and that could be very beneficial. And then lastly, just overall, being willing to fully engage in supportive collaboration with your school and with the student, fostering an environment of open communication can be very impactful in a positive way as we work together to navigate the process effectively. So now what I'd like to do is spend a couple minutes addressing some questions that have commonly arisen in the setting of experiential accommodations. These are questions that I've received and questions that I have kind of seen come up in the process in the past. So one question that's come up is, can the school or College of Pharmacy inform the preceptor of the student's specific disability? And the simple answer to that question is that, well, no, because we can't disclose specific health information, including disability-related information, at the school level. Now, some students choose to disclose that on their own, and some students will work with their program to disclose that specific information to the preceptor. But the reality is that they are not under any obligation to do that. Related to this question is the question of whether students with disabilities are required to seek accommodations. And the answer to that is no, they're not required to seek accommodations. The decision to seek accommodations is always voluntary, and that's up to the student's discretion whether they choose to do that. Another question that we have sometimes received is whether accommodations are available in the workplace, kind of in terms of how that relates to us providing accommodations in the experiential setting. And the answer to that is yes, accommodations are available in the workplace as required by the ADA. Now, of course, reasonable accommodations in the workplace would be determined through an appropriate process with the employer, but it is a process that's available, and it's a process that individuals with disabilities can pursue if they choose to do so. Another question that has come up or may come up is if there are costs or equipment that's associated with accommodations, who's responsible for paying for those costs or for providing the equipment? And now this is something that would be determined through the school based on the specific process that they have in place. I can tell you that in my experience, costs are often the responsibility of the school. And in our case at UF, our Disability Resource Center has mechanisms for navigating those costs pretty effectively. All right, and then additional questions that have sometimes arisen, questions that I've been asked is, how will implementing accommodations impact my workload with a student? And our answer to that is that in my experience, in many cases, there will be minimal to no impact in terms of increasing workload for the preceptor. We have had a few scenarios that have been somewhat more complex and needed a little bit more time investment. And then in those cases, we work individually with the preceptor to confirm the site's ability to meet the accommodations and have generally been very successful in navigating that process. Another question is, what should I do if I'm concerned, I, meaning the preceptor, if I'm concerned that an accommodation fundamentally alters the rotation requirement? And if that does occur, it would be very important for the preceptor to contact your school, college pharmacy personnel, experiential coordinator, basically, as soon as possible to discuss those concerns. That would be really important. And similarly, if you are experiencing challenges with the accommodation plan, or if it's not meeting the student's access needs, definitely one of the times you want to step in and have that dialogue, of course, with the student regarding the concerns, but then also reaching out to your experiential coordinator to discuss and kind of navigate through those concerns that you have. All right. So what I thought might be helpful here would be to shift gears for a moment and take a look at a case example. So for this case, we have JS, who's a preceptor who's provided an accommodation letter for an upcoming advanced pharmacy practice experience student. The student has been approved by the School or College of Pharmacy Disability Services Office for the following accommodations. We have assistive technology, speech to text, captioned telephone system if applicable, and access to closed caption video. So what I'd like to do is, if you have, as a preceptor, what questions come to mind regarding implementation of these accommodations? Feel free to unmute and just kind of let us know, or if you want to type something in the chat, that is fine too, and I will make sure I'm looking at the chat. So, anything that comes to mind in terms of questions that you might have when you receive this letter?
Hi, this is Megan. I think my first thought would be, how would the speech to text technology work within an electronic health record?
Yep. Good question. Anything else that comes to mind?
So Janelle, I'm wondering, I provide patient care, direct patient care. Is the student able to provide direct patient care
Okay.
and interview patients?
Okay. So kind of related to that, I think the question that's kind of coming, stemming from that, or maybe where that question is coming from, is what type of speech to text capabilities are needed? So like, in what context are we needing to use the assistive technology of speech to text? Is this going to be for all person-to-person interactions, or is it going to be only for specific settings, like in a large group meeting, or perhaps on rounds or something of that nature? Other questions that might come up are, who's going to provide the caption telephone system? Is the system HIPAA compliant? Is it going to be compatible with our site telephone system that we already have? I think Megan's question and yours was, what kind of speech to text technology are we going to use, and how does that work with the medical record system? So while there are lots of answers to these questions, and this just kind of illustrates why it'd be so important to have dialogue with the experiential office, with the disability resource professional, with the student, to understand like the context that we're talking about and what is going to truly be needed. I will mention just briefly that it's actually not uncommon to have speech and text software that works within medical record systems. Our physicians use that a lot to do dictation of to dictate their notes. So just kind of be working through, like, what does that look like? What technology is already available at the site that we could incorporate? And of course, that's going to all depend on the context that we need to use it for. So with that in mind, like, what are some things that we talked about today that might be helpful in helping us navigate those accommodations effectively? One of them I already kind of mentioned, and that was reaching out to the school with all these questions to make sure that we're dialoguing about the process and working all of these things out, kind of get the clarity and the steps forward that we need. Anything else that comes to mind?
I would love to meet the student beforehand, so if they're willing, so we can talk through what's reasonable at the site without disrupting the flow of patient care.
Yeah. And so, and as an experiential coordinator, that's one meeting, but then another meeting is the potential for that pre-rotation visit. That would be probably very helpful for some of the reasons that we already talked about. If we are going to need to use a caption telephone system, it's going to depend on the rotation. Like, they may not do a lot of actual telephone communication on the rotation, in which case it might not be applicable, but there would probably be a need for the student to visit ahead of time to even bring the device and to have it tested by IT and have them confirm that it's going to be compatible and something that can be used appropriately. So a pre-rotation visit would probably be very helpful for a lot of reasons. Yeah. And I do hope that perhaps there are other things we talked about today that would be helpful as well. So I think I need to close the chat here, there. Try that. There we go. So in conclusion, I wanted to be sure to mention just how important our preceptors are in the education of all of our students. Certainly our preceptors are training the next generation of student pharmacists. And as in that, preceptors are truly positioned to make a significant difference in the life and education of their students by creating educational environments that are supportive of all types of learners, including students with disabilities. We do know that navigating experiential accommodations effectively requires a team approach. We talked about a lot of questions that could come up in the process today, and we're going to need the whole team to work through those questions and make sure that we are navigating it efficiently and correctly and doing it well. So to further that end, what I'm going to do is actually, first I'm going to list some resources that you can use to refer to for additional information. And then I'm going to turn it over to Melissa to talk a little bit about the Western New England University procedure for experiential accommodation so that you'll be familiar with that. If I don't have a chance to say it, I want to say thank you so much for inviting me to join today. I will be around for questions that come up after Melissa is done. So here is the Western New England, the resources slide that you can look at if you would like to refer to any of these resources. And then, Melissa, do you want me to continue sharing or do you want me to?
I can just quickly talk
Okay.
about our procedures here. So in general, our students reach out to our student accessibility services, which at some schools is called student disability services. They may already have accommodations in place, such as a low distraction environment or extra time. Those are some of the things that we commonly see. And again, mostly that goes to exams. Sometimes a student will be pregnant on rotation and they ask for certain accommodations. Again, they go through their doctor and accessibility services. And then as instructor of record, I get a notification letter saying the student has been approved for these accommodations, and they list them. At that point, usually I'll meet with the student and discuss what the rotations will look like and what they think they will need. And if they feel comfortable notifying the preceptor ahead of time, I think in what I've seen over the years, things like the low distraction environment, extra time allowances, students in general have not chosen to use those when they go on rotation. And I can't say that's 100% of the time, but often in the classroom and the exams, it seems to be that they need a little bit more time than perhaps on rotation. I also think our preceptors, when they've spoken with students, so we've definitely had a couple pregnancy ones in the last couple of years. The preceptors have been accommodating, like they might be a high risk pregnancy. They need to sit down more often. They asked to be off to have a work from home day at a certain rotation, and it was accommodated due to the pregnancy, and driving and traveling every single day was very tiring. So those are the things that we have seen, but this is the order that they go in. They go to student accessibility services first. Preceptors all have a Zoom orientation with me before they start to precept. And so we definitely encourage them to be open with us, and we try to do as many site visits as possible. If there are any concerns about how things will work or should work, or if there's a problem on rotation. So this is the general steps. Janelle, I like your form a lot. I was wondering if that was just for absences, or if you have another form for some other accommodations you might see, like extra time.
That form is specific for health-related absences. So we don't have a specific form for other accommodations other than the accommodation letter. That is a formal letter. And so the students have that, and we have that as well. And we have a process for sending that to our preceptors. But that specific form is for us. Yeah.
Okay. Yeah, we ask students if they will be okay sharing information with the preceptor. And I think just every single time they have been happy to communicate what they might need with the preceptors so far.
I know we are almost at time, but does anyone have a question before we hit the 12:30 mark? And if not, that is totally okay. Thanks so much again for having me. I really appreciate the opportunity to be with you today.
Thank you, Janelle. Have you met with resistance from preceptors in the past about any accommodations over the years?
I would be honest, to be honest, I would not say resistance, no, but we definitely have had questions.
Hmm.
And so part of our process is we send out a de-identified letter before rotations start as much as we can. I mean, sometimes letters come in late, but so we can navigate questions well in advance of rotations. And we definitely receive questions that we'll dialogue about and kind of work through. For an accommodation letter like the one that you saw with the example that I provided in the slides, that kind of letter would be one where we'd probably set up a meeting and have a verbal conversation about the accommodations because those are a little bit more complex, and we would definitely need to work through exactly what that's going to look like for any given rotation. And so that would probably be a one-on-one meeting with each preceptor that it applied to. Yeah.
And would you have the student at that meeting?
Generally, the first time we have the meeting, no, because it's done in a de-identified fashion. So the
Uh-huh.
preceptors don't know what student it applies to. But then subsequent meetings, certainly we could do that as a group.
Mhm. Thank you.
You're welcome.
All right. Thank you all so much. A recording of this will go out soon as John gets that. And thank you all for attending. We will see you next month in May. Dean Welch will talk to us about some of the current pulse in pharmacy.